Hi, my name is Dr. Jonathan Hersch, and I'm an orthopedic surgeon practicing in Boca Raton, Florida. Today, I'm here to talk to you about shoulder replacements. Shoulder replacements in general are performed in the United States approximately 60,000 patients per year. Not as many as total knee and total hip replacements, but a significant number that is growing due to our aging population. First, I want to educate you about the anatomy of the shoulder. The shoulder joint has the most range of motion of any joint in the body. It is made up of the scapula and the glenoid socket and the humerus, which is your upper arm bone. This ball and socket is held together by the bone itself, ligaments, cartilage, and muscles, most importantly of which are the deltoid muscle on the outside of your shoulder and the rotator cuff muscles, which are four muscles that work in concert to move our shoulder and maintain stability. In general, a shoulder replacement, much like a knee replacement, is indicated for osteoarthritis, which we'll get into in a second. Arthritis of the shoulder is loss of cartilage and can be a very painful, limiting process for many patients. In general, most of our patients with shoulder arthritis can be managed non-surgically with physical therapy, modification of activities, injections of different substances, sometimes cortisone, sometimes platelet-rich plasma, or stem cell therapy is now being used for osteoarthritis. Unfortunately, many of our patients require surgery, and shoulder replacement is an excellent option for them to relieve their pain, discomfort, and restore back to a normal life. The most common causes of problems in patient shoulders that require a shoulder replacement are arthritis, rheumatoid arthritis, what we call post-traumatic arthritis, where you suffer an injury to the joint itself, chronic rotator cuff tears, osteonecrosis, which is a form of bone death at either the humerus or the glenoid socket, where the bone collapses, is a very rare but debilitating condition. The indications for a shoulder replacement is for someone in severe pain, limited activities of daily living, even pain at rest that doesn't respond to medications and injections and physical therapy. When you come to your physician with a potential painful shoulder and we diagnose you with arthritis, we will need certain x-rays, and to plan our surgery we often need an MRI to look at the status of the muscles and tendons of the shoulder, as well as a CAT scan to look at the bony anatomy of the shoulder to plan this technically challenging but rewarding procedure. The most common replacement done is a total shoulder replacement. When we say total shoulder replacement, we mean replacing both the humerus and the socket. This is an example of a shoulder replacement where in the model the humerus has a metal ball attached to a metal stem that goes inside the humeral canal, which is hollow, can be either press-fit into place or cemented depending on the patient's bone quality and surgeon preference. The socket, or the glenoid, has a plastic component which is cemented into the scapula. Sometimes the newer prostheses, like this one, has a metal post in the middle that allows for increased fixation. This restores the patient's normal anatomy, relieves the pain of arthritis, leaving all the muscles and the soft tissues around the shoulder to move the shoulder in a normal pattern. After rehabilitation, most of our patients get back to their normal life, including golf, tennis, bowling, and other sports that people can enjoy without pain. The other common shoulder replacement is a hemiarthroplasty, or a partial replacement. In that case, we just replace the humeral component and not the socket. Patients who would not have their socket replaced may be young, may or not already have arthritis of the socket developing. They may have osteonecrosis of only the humeral side, causing arthritis only on one side of the joint, making it unnecessary to replace the socket. And patients